Welcome and thank you for joining us for this Facebook Live media conference. Today's presenters are Gary Douglas, the President and CEO of the North Country Chamber of Commerce, and Erin Streif, Director of Healthcare Services at the Clinton County Health Department. CBPH Medical Center will be back with us next week. If there are questions regarding their efforts, we will try to get those answered offline and respond to those. Each of our speakers today will provide a brief update, and then we will do our best to answer your questions. Mr. John Canosa, Director of Public Health, and Mr. Eric Day, Director of Clinton County Office of Emergency Services, are on hand to assist with responding to questions as needed. And since we anticipate that duplicate questions on the same topic may be asked, please listen carefully, as the information you are seeking may be in the answer to prepared remarks of our speakers or as part of a response to a combination of questions. At this point, I invite Mr. Douglas to the podium.
Thank you. It's a pleasure to be here. It's especially a pleasure to have had an excuse for the first time in a while to shave and put a suit on. It feels great. It feels a little bit of normalcy. So thank you for that. I have to mention my appreciation for my understanding that Wyrie Hometown Radio is carrying this as well today, and I want to thank them as great members and supporters for doing that. The North Country Chamber of Commerce is the lead organization for business in the region. Certainly focused on Clinton County, but we also serve Franklin, Essex, Hamilton, Northern Warren, and Akwesasne. So we're covering a lot of territory these days in terms of bringing support services to the regional business community. If you haven't seen the reports, it's available on our website at northcountrychamber.com. North Country Forward, a plan for supporting business reopening in the North Country. You'll find a very simple, but hopefully logical outline that's guiding our support services to help all of you in the business and professional community and organizations out there to prepare for and successfully reopening as we come up to that, hopefully in the near future, and work our way through the upcoming phases. Two key components to what we are doing and will be continuing to do. The first is communication and outreach. Hopefully everyone in the business community is receiving the daily dose. We're now on edition like number 40. Seems amazing. We put that out every day to more than 5,000 recipients in the region, including most of the business community, and it has become, I think, a go-to source of daily info for business and community leaders around the region for up-to-date news, information, announcements, what other businesses are doing. We highlight some things that they're doing on there as best practices. A lot of good things in there that our staff is putting out every day. If you're not receiving that and you want to, again, you can go to northcountrychamber.com. You'll find a place you can sign up, get on that list, and start receiving the daily dose. You'll also find all of those past editions of it available online. So a lot of communication on that front. Also on the website, which again for the regional business community, I think has become a go-to source of info and links and guidance. So if you haven't visited that or you haven't visited it in a while and you're in business, you might want to check it out on a regular basis for updates and new things that are there. It's evolving and changing and growing every day. Has lots of information on the funding programs, on state guidance in various ways, all of our past webinars, and I'm going to touch on webinars in just a minute, but they're all there. Our teletown halls, the public officials are all there to go and view. Just access to a lot of things, including some special things. We have a virtual job fair on there for area employers who are hiring, and many are, and particularly as they come up to reopening. Many will be hiring once again who aren't at the present time. We can't do traditional job fairs, but we can do a virtual one online. There's a place to post job listings. There's a place there to find sources of supplies, hand sanitizer, gloves, masks, etc. Which particularly as we come up to reopening, more businesses are going to need those for their staff, their wait staff, and others as they come up to reopening. And so we have both local sources and out-of-area sources, and are always encouraging businesses to give us leads on other sources that they know of that aren't there. We'll add them, and you can help us help others by finding the things that they need. So just some examples of what's on the website. Take full advantage please, and let us know if there are things not on there that you think would be helpful, and we'll try to get those things posted and up there for you. Our second great mission now that is really stepping up is information and training. Each business, as we come up to reopening and before they can reopen, once they're allowed to, as we move through the phases, must have a health and safety plan. Now, larger companies have always had these. Manufacturers, construction companies, many other types of employers have always had safety officers. They've had safety plans, engaged in safety training. But the vast majority of businesses, particularly small businesses, haven't done that in a formal way. But you're going to need to now. You're going to need to designate, in our view, what we're calling a health and safety officer, a resource officer for your site. Designate somebody at your restaurant, at your retail establishment, at your office as the key person who's going to be in charge of taking all available training, getting all available information for your business, helping to translate it to you, helping internally to spread the information, make sure everybody understands what they're going to need to do, how things need to be rearranged perhaps at your work site, etc. A point person who will take the training and kind of be your chair, if you will, at your business for that. And then take advantage of the training that we're doing. We're doing 2 levels of training that's actually launching today at 10 o'clock, going on right now, and then again at 2 o'clock this afternoon. We're doing a basic webinar on back to business, what you need to know to reopen. This is a baseline webinar for basic information that all businesses and organizations need to know. The basic standards, the basic PPE, understanding distancing, understanding different types of masks, understanding some of the basics that everybody's going to have to know. It's free. If you haven't registered, there's still time to register for this afternoon's 2 o'clock edition. Go to the Chamber website. You'll find a place to do that. By the way, as I came to the office, we have more than 800 area businesses registered for the combination of these 2 webinars today. So we thank the business community for responding to the offer of training. These sessions will be posted after today on the website, so other businesses who weren't able to attend live today for one of the webinars will be able to view them at their convenience, and so still get the value out of it in the training. Then going forward, step 2 will be individual sector by sector training webinars that drill in deeper on the things that are specific to their type of business as a follow-up to the general briefing. Some of those are already designated or already scheduled. We have construction on May 15th, manufacturing on May 19th with our partners at SciTech, restaurants May 21st, lodging May 22nd. We'll be doing a series of other sectors in the ensuing couple of weeks thereafter. So again, all of these will be available at the Chamber website for more information and to register and keep an eye. They'll also be in the Daily Dose, so make sure you look at that every day or get yourself on that mailing list. Reopening is coming when it starts in the North Country, and we're hoping that we may get a green light any day now, but there's no guarantee. But our friends at the health department, hospitals, and others here and throughout the region are working very hard. They're going to get us there. It's a matter of what day that happens. We know it'll be soon. So stay tuned and watch for that, but don't jump the gun because we don't have a green light yet. So don't think you're opening Friday. We're not in phase 1. Make sure that you don't get ahead of the curve and be in violation. You don't want to be there. You want to know that you're opening after the allowed day and after you have done the training, gotten the information, and created your plan. You must have a health and safety plan for your business site. You're going to self-create it, hopefully with the guidance that we're going to provide through our webinars that you'll take advantage of, and other guidance, other guidelines that will be posted online that we'll also make sure are available on our website that you'll have to acknowledge you've reviewed and are incorporating in your plans. You'll need to keep that plan on your site, so friends at the health department or any customer, anybody at all can ask to see that. It's going to kind of be self-certifying. You're going to do it, but then it's going to be subject to review at any time on your site. You need to have that before you open your doors, and that's why we're getting ahead of the curve a little bit as much as we can with the training. There'll be a template that you will use to do that. That template is not available yet. That's a little bit frustrating, but everything's evolving and evolving quickly now. We're told that by the end of this week, the state will provide a template which everybody will use to put their information and their plans in to then create that plan that you're going to have at your site. And again, we'll provide guidance for that, and we'll provide access to that template as soon as it's out, which we expect by the end of the week. So keep that in mind. you must have that. Construction activities have to have one for each work site. So it isn't just for the construction company wherever it's headquartered. It's we're building this building in Moores. Well, you got to have one for that site. How are you going to conduct yourself in construction on that site? So there are a lot of wrinkles to this, and you want to make sure you're in compliance. With that, I'll just stress again, visit the website regularly, read, and if need be, subscribe to the Daily Dose. Take full advantage of the information that we have, and ask us any questions. We're happy. The health department and others have referred many businesses to us who have questions about, am I an essential business? What do I have to do to prepare for reopening? How do I access? I have some questions about the federal PPP funding program. I'm having problems. Can you help me? Any questions that relate to business, we'll be happy to have you contact us via our website or our phone number, 518-563-1000. And we'll get back to you either with an answer to the question or with how we will help you get an answer to the question. And again, thank you to the health department for all that you're doing. It's been a great collaboration. It's going to be one going forward. We will get through this thanks to the spirit of cooperation and sharing.
Thank you, Mr. Douglas. You have shown exemplary leadership and partnership, and we're so grateful to have been able to rely on your excellent work. So thank you for everything you're doing. My name's Erin Streif. I'm the Director of Healthcare Services for the Clinton County Health Department. I will start with a brief overview of our numbers for today. We have 121 total cases. Of those, 111 have recovered, 4 have died, and we have 6 who are currently ill. We are seeing a downward trend in the number of new positive cases, and this is happening even as testing capacity is increasing. So we know that it's due to your good work. Thank you for everything you're doing. Keep it up. The physical distancing, the hand washing, the mask wearing, this is making a difference, and we're protecting each other. I do want to speak to the current criteria for testing. As Mr. Douglas mentioned, we are looking to hopefully reopen. Part of reopening does involve having an increased capacity to test people, and we are seeing our local community providers ramping up to meet that need. I will review some guidance. This guidance actually came out from the State Department of Health on April 26th. It's on the state website. It's titled Updated Interim Guidance Protocol for COVID-19 Testing Applicable to All Healthcare Providers and Local Health Departments. We can post a copy of this after this press conference, but it details testing criteria, and it now includes not only symptomatic people, so for example fever, cough, shortness of breath, but also anyone who's been in contact with someone who's known to be a positive case, and it includes an individual who is employed as a healthcare worker, first responder, or other essential worker, and you do not have to have symptoms if you are in that category. There's an extensive list of who is included in the essential worker protocol. It's not just first responders, but it is also people who interface directly with the public, so people who work as bank tellers and grocery store workers and a number of other professions. So we encourage you, if you have symptoms or if you fall into either of those other categories, to work with your healthcare provider on getting tested. If you do not have a healthcare provider, WellNow, Urgent Care, and Hudson Headwaters in Plattsburgh and Champlain have capacity for testing, so you can work with them as well. So one more reminder, testing is a measure that occurs at a point in time. Having a negative test today does not mean that you will not potentially get infected at some point in the future. So the physical distancing and the hygiene and the mask wearing has to continue for the foreseeable future, even as we go into this reopening. The reopening is going to occur in phases, and these phases are going to be spread 2, 3, potentially more weeks apart, depending on how things go. If during phase 1 we see a spike in cases, that could potentially be a reason to hold off on proceeding to the next phase. And again, this is so important. As we go through the phases, we do have to still wear our masks, and we do have to still maintain the physical distancing. The virus still exists in the world. It's not gone just because we're reopening. So the vigilance is going to be essential. The phases I will just touch on briefly. Phase 1 includes construction, manufacturing, and select retail using curbside pickup only. Phase 2 includes professional services, finance and insurance, retail, administrative support, real estate, and rental leasing. Phase 3 includes restaurants and food service, as well as hotels and accommodations. And Phase 4 includes arts, entertainment, and recreation, and education. And just a reminder, each of these phases are weeks long, and we cannot guarantee how many weeks. I know there's a lot of interest in being able to plan for things maybe in September or future planning. We have to wait and see how things go. This is going to be rolled out in a very methodical and careful fashion so that we can protect people's health at the same time. It's going to be a balancing act. We will, at Clinton County Health Department and at the county, continue to be here for you. We are here for you throughout this entire process. We're going to continue our contact tracing, our isolation, our quarantine, our containment measures. Everything that we've been doing is going to be ongoing for the foreseeable future. This is what we do. I want to just acknowledge that this has been a strain, and we continue to face uncertainty, and uncertainty is not easy. It will be a process. I wish I could make promises. I wish I could give definitive answers, but we will continue to work together and we will prevail. Thank you. Should I stay here for questions?
Sure. So one of the big questions that we have been seeing, and I know you touched upon this a little bit, but people want to know, are we opening on Friday?
Not yet have the green light to open on Friday. We are just a few tests short of meeting the 419 average test per day criteria that's been set forth by the state. We are working today, even as we speak, with CVPH to increase our testing numbers, so that could mean that tomorrow we have enough tests. We're taking this one day at a time.
Thank you. There was a question asking, how can we open when the number of cases continues to increase? So if we're still seeing positive cases, how can we open?
We will continue to see positive cases. This is a virus that's not going to just disappear. We expect to see positive cases as we continue to open. So we don't have to reach 0 cases to open. The goal is to have enough of a control over the cases in terms of having enough contact tracers to do the investigations and subsequently issue isolation and quarantine orders and implement control measures. And then the other factor is making sure that the hospital is going to have the capacity to take care of people who need that level of care. It doesn't mean there will be no new cases. It means that the amount of new cases is a manageable amount of cases, and right now we are there.
Thank you. How can residents get tested?
So if you have a primary care doctor, call your primary care doctor. You still have to fit into one of those criteria that I discussed. So that's being symptomatic, being a known close contact or proximate contact of a confirmed case, or being an essential worker who interacts directly with the public. If you fall into one of those categories, you can work with your healthcare provider to get a test, and if you don't have a primary care provider, you can call WellNow or Hudson Headwaters in Plattsburgh or Champlain to proceed with testing.
Thank you. This question is in regard to plasma donations, but they were looking for CCHD's opinion. The question is, why is the CVPH Blood Donation Center only allowing plasma donations from individuals with a positive diagnostic COVID-19 test, so not from those who've only had antibody testing?
That is really a question for CVPH to address directly, but that's their protocol and their capacity that they've determined at this time. That may change going forward as we have updates, but that's a decision that they make as a facility.
Somebody asked, why do we have to pay a copay to get antibody testing?
I'm not familiar with there being a need for a copay for testing. I do want to clarify though, when I'm talking about the current criteria for testing, the test that we as a health department are interested in having the result of is the PCR test. That's the diagnostic test that lets us know whether you're currently infected or not, because that allows us to implement those containment measures and control the spread of the disease. Antibody testing is not included in this category because an antibody test should confer some level of immunity, but we don't have enough research on this disease yet to understand exactly what that immunity looks like. We are not sure how long it lasts. We're not sure if you even have full immunity if you have a positive antibody test. You may still get sick with maybe milder symptoms. It's all not thoroughly understood at this time, and so research into that is ongoing.
Thank you. Part of this question, I think we may have new listeners that are just joining us, so part of this may have been answered already, but there's a question asking, are there concerns about a resurgence of the virus once opening back up? And if so, what is the plan then?
Yes, we will be carefully monitoring new cases as the reopening happens, and that's why I'm emphasizing that it's going to happen in phases, and the phases are going to be weeks apart so that we have the ability to get a good understanding of what's going on in terms of spread of disease as the reopening happens. If we see a spike in cases, everything goes on hold until we can understand what's causing that spike, stop it, and then proceed.
Thank you. So one of the other questions we received, and I don't know, Erin, if this would be one for you or for Mr. Douglas, but we've received lots of questions asking when specific entities will open. So things like playgrounds, tattoo, hairdressers, dog parks, camping. People want to know when the DMV is going to open, lots of other entities.
If you want to come speak to this, you're welcome. But I will just say these guidelines, our regional guidelines for reopening in New York, they are on the website and they actually follow CDC guidance, so that can be found online.
The answer to the question, there's kind of a couple different parts to it. One, of course, is we first have to qualify as a region, according to the 7 criteria, to start the so-called phase 1. Phase 1 is actually now very well defined in terms of the types of businesses that will be allowed to reopen. But I again stress, you don't just open your doors, you got to have a plan in place and you got to comply with guidelines. And so all businesses should start now in preparing those plans to be ready for when the phase eventually comes that they're a part of. If you're in one of those later phases, it's a little fuzzy. Phase 1 has now been very well fleshed out, so it's pretty easy to see if you're one of those phase 1 businesses. Again, you'll find that on the Forward New York website. You'll find it on the Chamber website if you want to access that and you haven't seen it yet. It was in yesterday's Daily Dose as well, spelling out phase 1. So if you want to see what we expect, we're going to be able to start opening within the next week or so, if all goes according to our expectations on the testing front. You can look at that list now and pretty well judge that, I'm that type of business, I'm going to be able to open as soon as they tell me phase 1 starts, still subject to having to have that plan in place, so take the training. Phases 2 through 4 are still very vague. For example, professional services. Well, what's a professional services and what isn't? We don't know yet, but they have promised through the State Advisory Board. I was in 2 meetings last week where we were able to ask some of these questions, that within a matter of days, which would mean by the end of this week, that they intend to flesh out those phase categories as they have done with phase 1, so it'll be more understandable. I would fall into 2 or I would fall into 3 or 4. So stay tuned, watch the daily announcements, watch the website at the Chamber if you're a business. We'll have those updates. But again, I keep coming back to it because it's important. You cannot reopen if you're a widget company and on the list says widget companies can open Monday. Well, yeah, theoretically, but only if you're ready. is you first have to have that plan that you have in place, that you've gone through, you've complied with the guidelines, you certify you understand the guidelines, you have a written plan. So start doing that now, no matter when the date may come, as to when you officially may be able to reopen.
Thank you. One of the other questions we received is, who is going to fund the mandate to have a safety officer and extra training? I should have warned you, I apologize.
That's okay. The safety officer is not a mandate. The safety officer is not a new position. It is a standard practice in the world of occupational safety that has been around for years, that many businesses have always had a safety officer on site. In case of a small business, a retailer, an insurance office, a restaurant, it's not a mandate that's going to cost you anything in terms of the person. It may be the general manager. It may be the owner of the business. It may be a family member that you think would be good at that. It may be a team member that you're bringing back on board who you think would like some new responsibility and would be very diligent and have good attention to detail. Whoever you designate in your business, we're just saying somebody should be in charge. If nobody's in charge, things are going to fall through the cracks. So think about whether it's you or somebody else at your business, an existing employee, who's just going to take charge of marshaling that for you, taking the webinars and the training sessions, helping to prepare that write-up of a plan that you're going to have on site, and then stay on top of things. So it's a way of thinking. It's not really, don't think of it as a costly mandate. In terms of the training to do that, the Chamber is doing this all for free. So all of the webinars I've mentioned to date and those going forward are being offered as a service of the North Country Chamber of Commerce as part of our mission to the regional business community, and they're free. So take advantage. There obviously will be some costs in conforming your site. There may be, you may need to acquire masks. You may need to acquire some other PPE. You may need to do some physical changes in your setup. So in those cases, there may be some costs involved in doing those things, but we're making it possible for you to have the training at no cost.
Just a couple more questions, I
Related
apologize,
to
before
business?
you walk
Okay.
away, yes. Are businesses expected to turn the plan in someplace, or what do they do with it once created?
At this point, that had been a question. All right, so we create this plan. Who is it that's going to approve it? At this point, it's considered to be, the term I would use is self-certifying. So a template is going to be provided. Hopefully you take the training sessions, get the technical guidance, look at the guidance that's going to be put out very soon for each one of those sectors. It's going to give you more details of how you need to space at a restaurant, for example, or how you need to do things. That isn't all out there yet, but it will be soon. You need to look at that and incorporate that into your plan and your thinking. Then you have it on site. The health department could come by and say, we'd like to see it. A customer could say, I'd like to see it. I'm in this restaurant. I want to know, I hear you have to have a plan. I want to look at it. So it's going to be publicly available on your site for anybody that wants to look at it. Something to be cognizant of, too, is that there will be enforcement. There will be checks. One of the things we've been told in answer to questions is that every region is expected to have at some point, it doesn't exist yet, a hotline and a procedure for anybody who thinks somebody may be falling short of what they should be doing. They can express that concern and it can be checked out, which I know every business wants to do the right thing, but there's also going to be a process by which if somebody thinks somebody isn't getting it right, they'll be able to say so and have it checked.
I don't know if this is, so this is one of the other questions. How have large stores like Lowe's and Walmart stayed open, but smaller local businesses, such as furniture, have been forced to stay closed?
It's simply a matter of a decision by the state of New York, and I think there are some unintended consequences that I'll express on behalf of the Chamber that certainly have been unfortunate, but as we get into reopening, we can hopefully get past this. But certainly, there have been some things that have been unfair with the way things worked out. So because a major box store sells groceries and is open, so it also is selling sporting goods equipment, but Play It Again Sports can't be open. Or the supermarket can sell flowers, but the flower shop hasn't been able to be open. I absolutely agree that has been an unfair set of circumstances. I don't know how it could have been or would have been done differently. We see the chaos that's ensued in places like Michigan, where they tried to narrow it down to say, well, the supermarket can open, but they can't sell these things in the supermarket, and we've seen that has caused other problems. So there probably wasn't ever going to have been a perfect solution. It has been an unintended consequence. That's why we're anxious to see our small businesses who have been kind of unfairly closed in the face of competition from online and big box stores, to see them hopefully successfully reopen as soon as it's safe to do so.
Very much. I
Yeah.
think that was my last. I think that was my last one right now. Thank you. There's multiple comments asking specifically, are local governments and agencies specifically listed in any of the phases? And then multiple questions about preventive services and mental health services opening back up.
Would you be able to give more specific details on any of those questions?
So one of them was just specifically, are local governments and agencies specifically listed in any of the phases?
No, not to my understanding.
And then the other question was, when will preventative services and mental health services open back up? And they were indicating more specifically for children.
A lot of mental health or emotional and behavioral health services actually are continuing to operate, but they operate in telehealth function. There are providers who have been able to sustain those types of services in other ways that maintain the physical distancing, for example. So a lot of those happen to be more on a case-by-case basis, based on the provider's ability to adjust their services appropriately.
There's another question. Are there any recommendations on how often essential workers should be tested?
That has not been specified for most essential workers. Nursing home staff at this point are expected to be tested twice per week. That's via an emergency order, and that goes at least through the beginning of June. That may change when we get to June and we observe what those tests have shown us.
And I think this is our last question. Are golf carts allowed?
Yes, actually, John Canosa, the director of the health department, is able to speak to that, being an avid golfer himself.
Thank you very much.
Thank you.
Thank you, Aaron. The question was with regard to golf carts being allowed. At this time, golf carts are not allowed. I know this a number of ways. I golf with my son all the time, and we're walking at this time. I do understand that there is the possibility that if one of the golfers has a disability, golf cart can be used. You would inquire at the specific golf course. Always call them first, obviously, to see if they're open, to see if they can allow use of a golf cart for someone with a disability, perhaps. But golf carts, golfing in general is recreation. However, golf cart use is basically you're separated from other people, usually with a family or a friend. There's not a lot of close contact with people when you are golfing, so there is the possibility that not only golfing will be allowed, but golf carts will be allowed in the very near future under Phase 4, recreation, perhaps as early as July. That's all we know for now. As Gary had indicated, we are working phase by phase. We're on Phase 1 now. Take it step by step, and we will get more information. We're getting new information just about every day on everything regarding this matter. So I hope I answered the question reasonably.
Thank you very much.
Okay.
Thank you for joining us today. We appreciate all of your questions, and we hope that we have answered most of them. We recognize that the answers sometimes are slowly coming to us, and as we get them, we will share them with you. Thank you again.